Did you know that prostate enlargement affects more than half of all men over the age of 50? And while there are a variety of treatment options, it's important to catch the signs early. If you don't know what those signs are, you're in luck. In this video, we're going to show you what to look out for and how to stay ahead of any potential prostate problems, particularly an enlarged prostate. But before anything else, let's get to know more about the prostate gland and this condition. Firstly, the prostate is a small gland that's about the size of a walnut, and it sits just below the bladder. When it gets bigger, it puts pressure on the tube that carries urine from the bladder, which is called the urethra. This then causes problems related to urinating, like trouble peeing, pain, and even dribbling after you pee. Benign prostatic hyperplasia, or BPH, which is also known as prostate enlargement, is a condition that affects more than 50% of men aged 51 to 60. As men get older, the chances of having BPH increase even more. In fact, over 70% of men between 60 and 69 years old and over 80% of men over 70 may experience this condition. But if you're younger than that, don't be complacent just yet. It's worth mentioning that BPH can occur at any age. Now let's answer the big question. What causes the enlargement of the prostate? As men age, hormonal changes occur in the body that can lead to an increase in cell multiplication in the prostate. For instance, as men get older, they tend to have higher insulin levels, which we refer to as hyperinsulinemia. Insulin, being an anabolic hormone, has the potential to stimulate cell growth and multiplication, including prostate cells. As men get older, they may notice a decrease in testosterone levels. This happens because testosterone can be converted to estrogen. This conversion is linked to prostate enlargement and urinary problems, making hormonal regulation in the body even more complicated. And all these hormonal imbalances may also affect the prostate, causing it to become enlarged. The process can be exacerbated if you have liver damage, are overweight, eat too many junk foods, or drink alcohol excessively. Now, if you want to find out more about this often overlooked condition and how best to manage it, then keep watching. Let's first discuss the early warning signs of prostate enlargement you should keep an eye out for. Number 1. When you pee, you get the urge to get all of the urine out, to the point of strain yourself. Have you ever felt this after peeing? You feel like there's still some pee left for you to get out. But nothing seems to come out no matter how hard you try and force yourself to pee. This can be frustrating and worrying at the same time. Unfortunately, this feeling of having some urine left inside once you stop peeing, but not being able to get it out, could be a sign of an enlarged prostate. The opposite is also true, which is another sign of BPH you should watch out for. Number 2. You feel the urge to pee immediately and more often than usual. Have you ever experienced that sudden urge to urinate? This is known as urinary urgency, and in men, it can happen when the prostate gland becomes enlarged or swollen. You see, when the prostate puts pressure on the tube connecting the bladder, it sends a signal to your brain that you need to go, even if there's no pee for you to pass. And to add to that, an enlarged prostate can make it harder for urine to flow out of the bladder. This then results in more frequent bathroom trips for you throughout the day. Sometimes you may even end up peeing in one of the most inconvenient times for anyone to keep making bathroom trips in, which is the next sign of BPH you should watch out for. Number 3. You experience nocturia. Nocturia, which is also known as nighttime urination or peeing at night, is a pretty common symptom that's often linked to an enlarged prostate. Guys dealing with BPH often find themselves making multiple trips to the bathroom during the night. Typically, getting that sudden urge to pee wakes them up even. So, as you can tell, nocturia can really mess with your sleep and end up throwing off your whole day. Not to mention your health, since lack of sleep can cause various health problems. Unfortunately, many people tend to brush off nocturia, thinking it's just a normal part of getting older. But here's the thing, that's not true. Nocturia is actually also a sign of high insulin levels, which can affect both the prostate and the bladder. Number 4, you get bladder stones. In more severe cases, when the prostate gets bigger, it can put pressure on the urethra, causing trouble with peeing. This can also lead to bladder stones. As a result, guys with BPH might feel like there's this constant pressure in their lower belly even after they've peed. The bad news is that that's not the only painful sign of an enlarged prostate. Number 5. You get diagnosed with UTI or urinary tract infection. When you have an enlarged prostate, it can make it difficult for your pee to flow smoothly from your bladder. This can lead to urine retention. And when your pee stays in your bladder for long, it creates an environment where bacteria can thrive. As a result, your chances of developing urinary tract infections or UTIs increase. Some common symptoms of UTIs include a burning sensation or discomfort when you pee, urine that looks cloudy, and feeling like you need to pee more often. Now, if you have severe UTI, you may also experience the next sign. Number 6. There's blood in your pee. If you happen to see blood in your urine, it could be a sign of a swollen prostate that's pressing on your urethra and possibly causing injury. While this condition, called hematuria, can be caused not just by an enlarged prostate, but also urinary tract infections or bladder stones. What's important is to talk to a healthcare professional soon. Blood in your pee requires you to get a proper diagnosis and the right treatment. It's a sign that needs to be taken very seriously. Number 7. You experience dribbling after you finish peeing. One other common sign of BPH is when you can't fully stop your pee flow after going to the bathroom. It can be really frustrating because you end up dribbling or leaking urine into your underwear, which is not only uncomfortable but also embarrassing. After all, pee stains on your clothes are nearly impossible to hide. It's even worse if the smell of your pee is really pungent. Number 8. You ejaculate painfully. Men who have an enlarged prostate might feel some discomfort after ejaculation or even during intercourse. This can be like a radiating pain or pressure sensation in the perineum, which is the area between the anus and the base of the penis. Now, just a quick reminder, we shared these signs for educational purposes only since we're not medical professionals. But if you happen to experience most, if not all, of the signs we talked about in this video, it's always a good idea to consult a doctor. They can give you an accurate diagnosis and come up with a treatment plan that's right for you. But let's say you've already been diagnosed with an enlarged prostate. The good news is that you can do things at home to help your prostate get back to being walnut-sized. To start with, you can add high-intensity interval training or HIIT to your fitness routine. Did you know that doing just 10 minutes of HIIT twice a week can have a significant impact on testosterone levels in men? It can help reduce anabolic hormones like DHT, estrogen, and insulin that contribute to BPH. And here's the best part. When your hormones are more balanced, you have a better chance of getting your prostate back to its normal size. What's more, exercise, including HIIT, also allows you to burn excess sugar in the blood. And all that sugar could be contributing to high insulin levels and inflammation in the prostate. Another way for you to naturally address prostate enlargement is to fast. This is actually one of the most effective ways to shrink an enlarged prostate. Not to mention it can help clean out the liver of excess fat. See, if you're carrying some extra weight around your belly, or if you enjoy a daily drink, chances are high that you have a fatty liver, and that can lead to hormonal changes and inflammation, affecting not just your prostate, but your overall health. Intermittent fasting is actually a proven method to boost the condition and size of your prostate. It's all about alternating between periods of fasting and eating. By giving your body a break from constant digestion, it can really focus on repairing and healing itself. And yes, this includes repairing and healing your prostate so it can go back to its normal size. For optimal results, it is recommended to follow an intermittent fasting plan. This involves consuming all of your required calories per day within a 4-hour window. You then follow it up by a 20-hour fasting period. By implementing this routine for 2 to 3 days per week, you can achieve the best outcomes. And the best part is, it doesn't cost a thing. It's also a good idea to remove all dairy products, sugar, and alcohol from your diet immediately. Dairy products, including milk, have growth hormones that help baby cows grow. But here's the thing. Guys with an enlarged prostate can get super sensitive to these hormones, which can make their prostate even bigger. Alcohol is no different. When you drink, it messes with your liver cells and causes a spike in estrogen, which is another hormone that's known to make your prostate enlarge. Now let's talk about sugar. It's got a similar effect as dairy and alcohol. The only difference is that when you eat sugar, it raises your insulin levels, which can then trigger prostate enlargement. To ease the symptoms of BPH, it's recommended to cut out hormone-rich foods like milk, cheese, and yogurt, as well as alcohol and sugar from your daily diet. Here are 2 more videos you may find interesting. If you enjoyed this video, give it a like and share the video with your friends. And for more interesting videos like this, subscribe to the channel.